Every year, 350,000 people die from cardiac arrest. Most occurring outside of hospitals, in public areas such as schools or homes. How many of these incidences could have been prevented through skills acquired by the community? In these sets of videos, you will learn about the importance of CPR training, how to conduct it the right way, and how to ensure there is a safer community around you. Cardiopulmonary resuscitation, or CPR, is the life-saving emergency response given by an upstander when an individual enters cardiac arrest and is unable to function properly. It helps keep blood and oxygen flowing to the brain and vital organs until professional help arrives. Many people often confuse cardiac arrest with a heart attack. A heart attack occurs when there is a blocked artery, which is a vessel traveling to the heart, causing decreased blood flow. Studies have found that 85% of the heart is damaged within the first 2 hours of the victim not receiving help. Cardiac arrest occurs when the heart has an electrical failure, meaning it performs irregular heartbeats and cannot pump blood to the rest of the body. This chart depicts some of the main causes of cardiac arrest, and to name a few: hypovolemia, which is severe blood or fluid loss; hypoxia, which is a lack of oxygen; drug overdose by toxin or tablets; and major injuries known as trauma. Unlike cardiac arrest, heart attacks start off slow and build up over time as there are more clogs, but both can be fatal by shortage of blood travel. It is important to be able to tell the difference in symptoms between a heart attack and cardiac arrest, so you know what to perform to increase a victim's chances of survival. Heart attack symptoms include passive discomfort in the victim's chest, pain in areas such as the jaw and the neck, and breaking out in a cold sweat. Cardiac arrest symptoms differ in a way that they cause immediate collapse, no pulse, and loss of consciousness. In both cases, call 911 immediately. When you perform chest compressions, you are manually pumping the heart. This creates a pressure in the chest called an intrathoracic pressure, which pushes blood to the organs. As rescue breaths add oxygen to the lungs, the body is kept alive. As the victim may experience irregular heart rhythms, an AED, or automated external defibrillator, can deliver a shock that will restore it. More on that will be explained soon. With that being said, let us officially begin the training. I want to start by introducing the chain of survival, constructed by the American Heart Association, which are a series of steps needed to improve survival, and they consist of the following. But the first 3 are where upstanders like you make the biggest impact. To give a quick run through of the contents that are in the chain of survival, it all begins with the immediate recognition and activation, which involves identifying that a person is unresponsive and not breathing normally, and calling 911. This starts the clock so that advanced help can begin their journey. The next step is early high-quality CPR, which is performing chest compressions to manually pump the blood to the heart and brain. This also prevents permanent brain damage and keeps the heart in a shockable state for the next step. The next step is an automated AED defibrillator through active defibrillation. This will be used to deliver an electric shock that can reset the chaotic heart rhythm. Remember, every minute without a shock reduces survival odds by about 7 to 10%. The next steps are usually what medical professionals will do, such as advanced resuscitation, which will be provided advanced support that will use specialized medications and airway tools. The next step is post-cardiac arrest care, which is after the heart is restarted, the patient is treated often in an ICU to stabilize their condition and treat the underlying cause of the arrest. Recovery is the final link, which focuses on the long-term journey, which includes physical rehabilitation and assessments to support the survivor and their family. Time is of the essence in situations like this, because what you do in the first few minutes matters the most. For example, if the brain doesn't receive enough oxygen or blood, it can go through damage within 4 to 6 minutes. And as emergency responders don't always arrive during that time, it is vital that you know what to do in a situation like this through CPR. Early recognition is the initial counter of the victim, in which you will be assessing their breath rate and their sudden collapse. Your approach should not be to immediately rush over to them, but to abide by assessing the scene for safety, making sure you are safe too. Ask yourself if you are in danger. If the scene is safe, quickly assist the victim using coercive forms, such as tapping on their shoulders or yelling to check responsiveness. If the victim is unresponsive, you will immediately locate a nearby individual and direct them, stating, "You call 911 and get an AED." If there is no one around you and an AED is not present, quickly locate a device that can contact emergency services and still perform CPR. Assistance is assistance, no matter how small it may seem. You have successfully followed the first instructions in the chain of survival. In the next video, we will follow through with the chain of survival, and you will learn adequate compression and ventilation techniques.